There, welcome back to This Morning. Now, hospitals are facing their busiest time of year, but did you know that a huge 40% of A&E patients could be better treated elsewhere?
So, Dr. Sara's here with our reminder of how urgent care centres, pharmacies and 111 services can actually help. Morning, Sara.
Morning.
Obviously, we should clear up the fact that when should we be using 999?
So 999 is for emergencies, life-threatening emergencies. You know, think serious road traffic accidents, strokes, heart attacks, and A&E, similarly, you know, life-threatening injuries or accidents or conditions. So reserve A&E for when it really is.
When you really need
a problem,
life and death.
Also, travelling in an ambulance, reserve it for when you really need it as well, because just because you get there in an ambulance doesn't mean that you go to the front.
Yeah, I have lots of patients saying to me, oh, yeah, but I'm going to call an ambulance so I can get there quicker. And I want to tell everyone, you know, that isn't necessarily the case. You still get triage in the same way when you come by ambulance or you walk in. So you still need to be triaged, assessed by a nurse or a doctor to determine how serious your condition is as to when you'll get seen. Yes, you know, of course, if there's been a big serious trauma incident or a heart attack or a stroke, the ambulance are able to call in ahead to let the doctors there know. But if it's not one of those things, you won't be seen any sooner by going through the ambulance.
And when you look at the statistics, I mean, 40% of people who actually go to A&E could have gone somewhere else, could have maybe phoned 111. It's unbelievable, isn't it?
It is staggering, and actually that was a statistic unveiled by the NHS England. And even last week, a top A&E professor who's called Julian Redhead really urged everyone to be using 111 where possible.
OK.
So clear it up for me, because actually I didn't know.
You wasn't even in the country when this came out, was
I
you?
didn't know about 111. Tell me, how do you use it? Who should use it? Why do you use it?
OK, so if you think you need any medical help, you can access 111 either by phone, so you call 111, or you can go on the NHS 111 website and go online. And they'll arrange a callback, and the callback will depend on the symptoms that you describe.
It's
so
really good, actually.
Yeah,
They go through a series of questions, because I did it when my son was really ill. And because I didn't know whether to take him to A&E, I didn't know what to do, really. And they went through the series of questions, and it leads to whatever solution. They might say, go to your doctor. They might say, go to the A&E.
Yeah, there are lots of different outcomes. So 999 is one of the outcomes they might say. They might say, actually, you can go to an urgent care centre, an out-of-hours GP. They might say, actually, this can be something the pharmacy can do, or you can wait to see your own GP. Or they might say, well, actually, this is something you can manage at home with X, Y and Z.
Yeah.
So they are there if you're not sure what you should be doing. They're the ones that you can call, and they can also book your appointments to the right places.
That's a great idea. What about mental health problems as well?
Yeah, they manage mental health problems. They also manage dental problems. So in terms of mental health, when you give them a call, if you press option number 2, that takes you through the mental health triage.
What about urgent care centres?
Yes, urgent care centres are often in the same buildings as A&E and, you know, are often nearby, but they aren't the same thing. So urgent care centres are great if it's not a life-threatening accident or emergency, but they can still deal with things like broken bones, sprains, burns, skin infections, you know, sore throats, all of the kind of things that you might need to see someone urgently about, but not necessarily as an emergency. They can also do things like ECGs and X-rays and blood tests. So they are really, you know, well equipped to do a lot of things that you don't have to go see an A&E doctor about.
And can you just, like, rock up, or do you have to phone up?
Well,
you know, I'm like, I just want to rock up.
Can
you just rock up? Do you have to phone?
Some of them you can, you know, they are just... I don't advise emailing them, but yeah, you can just rock up in some of them. But I do actually recommend going by 111 first, because they can actually book you an appointment, so that limits your waiting time. And they can make sure that you're actually accessing the right place, because it may not be that the urgent care is the best place in the local services for you.
And the other thing that we've really learnt to lean on as well, I think since the pandemic, actually, are pharmacies.
Oh, yeah.
Like, you get to know your pharmacist and your local chemist, and they can really help in certain situations.
I completely agree. I think pharmacists are a really untapped wealth of medical knowledge.
Yeah.
They, you know, they're highly trained. They go through a lot of training to get to the point they're in, not just in medicines, but also in certain health conditions. And they've just got this new initiative called Pharmacy First Initiative, whereby they can treat with medical, you know, prescriptions 7 different conditions, and they're very common conditions. So
Yeah.
we've got impetigo, infected insect bites, earache, sore throat, sinusitis, urinary tract infections, and shingles. So all things that, you know, come up quite commonly,
Yeah.
especially at this time
I mean,
of year.
this would take so much pressure off the
So
NHS,
much
wouldn't
pressure.
it? It really, really would.
Yeah.
And also get people treated quicker
Yeah.
too, so then their symptoms don't get to be as bad.
Yeah. Do you know what I always get worried about? That I'm going to get ill over the Christmas period.
Yeah.
You know, like on Christmas Day or anything. What should you do if you was ill over that period?
Yeah.
How do you get a GP appointment?
Well, if your GP practice itself isn't open over that, you know, specific period, then you can, again, call 111 and they can book you in with an out-of-hours GP.
Oh, really?
Yeah, so out-of-hours GPs can even do home visits in certain cases. And it may be that they'll book you into a practice that's working in out-of-hours. It might be an urgent care centre. They might be working out of a pharmacy. So there are lots of different areas that out-of-hours GP can be, but they'll give you the most local place and you'll be able to see a doctor.
111 are going to absolutely hate me. Literally, any problems, I'm like, 111?
But you know what, there's helplines that
Yeah.
you could call too, right?
Yeah, this is a great one. So there are certain charities, things like Asthma UK, Diabetes UK, British Heart Foundation, and they all have helplines associated on their websites.
Right.
And often there's medical professionals on the other side of it. And actually, if you have any queries about your medication, about your treatment plans, any issues that you're worried, for example, your asthma, and you're not sure which pump you should be using, you can actually call them up as well, and they might be able to give you advice.
It's similar to, like, if there's something wrong with your eye, you can just go to the optician, is that right?
Yeah, actually, opticians are a very great resource because if you have any issues with your eyes, often people will come to see me as a GP, but you can see your optician, and they can also do referrals to an ophthalmologist, so you don't have to see the GP for that referral.
Amazing. Dr. Sara, that was incredible.
That was brilliant, wasn't it? When I saw the brief, I was a bit like, oh, I hope nobody needs an A&E. But it's good to know all of that information.
Some people just don't
and
know.
have it in the back.
Prepare yourself.
Great
It's
new
always
hair,
better.
by the way, as well, Dr. Sara.
Lush.
Very gorgeous. Thank you.
Hi, everyone. Just wanted to say thank you for visiting our This Morning YouTube channel. Now, listen, we upload new content every day, so go ahead and hit that subscribe button so you don't miss out. And we'll see you in the morning.